Okay, so it's a part 3 because I've just thought of something else that I failed to say. Let's give you a little look at that little gap in the clouds. I don't know if anyone's heard the British proverb. Is it a proverb or a saying that if it's grey and rainy, if there is enough blue sky appears to make a sailor a pair of trousers, it will stop raining. Which is quite quaint, isn't it? So is that enough to, it's not actually raining, it was spitting earlier. Is that enough to make a sailor a pair of trousers? Who knows? So yeah, I'm back with something else that I forgot. And this is talking about counsellors and therapists that work in particular settings. So for example, some counsellors and therapists will work in probation, or they'll work in jails. Or they'll work for agencies working with things like drug and alcohol issues, areas where there is a higher than average degree of criminality. But really, this can apply in any setting. Really, is sometimes clients can be hostile, aggressive, fixated on the therapist, and can become stalkers. And that's not unheard of. I've worked with a number of colleagues in agencies who have used a different name professionally to their personal name. And back in the day of, do we still have phone directories? I don't know. I'd never see one. But back in the days, when your phone number could be made public, they would go X directory and stuff like that. So you have to be very careful. And this does tend to occur much more in like prison settings and things like that, and probably more to women. Although male therapists can get stalked by female clients, but it's more often, I think, the other way around. The thing is, because therapists are so attentive and so affirming and positive towards their clients, some people have never experienced that outside of the confines of a romantic or sexual relationship, and they can't get their heads around the fact that that's just the therapist being the therapist. It's not that the therapist is in love with them or wants to sleep with them. And they can become fixated. And generally speaking, that's not good. I've been in situations a couple of times where clients have, one fell in love with me, this is a key example. Well, I've had probably more than two, but I think he did two kind of big examples where one fell in love with me big time, and the other fell in lust with me big time. And in both cases I said, well, look, we're not going to have a romantic or a sexual relationship, but I can promise you that that's not going to happen. And it's not going to happen because I value you and your well-being, and it's never in your best interest, and also it's against all the professional boundaries and rules and guidelines and ethics. But I've also said, but I'll continue working with you. I haven't abandoned them. Some therapists will panic in these kind of situations, and sometimes in an agency it's more easy. You can just swap somebody over to a co-worker, and sometimes that's not a big deal. But I think it's really important not to abandon clients. I can keep my boundaries and continue to make sure that it's safe. But that's in the case of an attraction. In a case of like a fixation or a stalking, that's a whole different matter, and that's something we as therapists need to be wary of, and careful. It doesn't happen very often. Like I say, it happens more in some settings and some situations than others, but it certainly does happen. And as therapists, we need to keep our clients safe, and we need to keep ourselves safe. So that's why all these things need to be considered. So like I say, it's not like a thing that a therapist, there's no rule that says a therapist shouldn't have a YouTube channel, but a therapist needs to think about that. You need to think about your whole internet footprint. For example, at one point, because I was being very what's the word, entrepreneurial. I used to do ghost tours and things like that, and I had a lot of costume, and I used to dress up, and I assembled for myself a highwayman costume, and actually at one point I advertised as a highwayman kissogram. Now, I've never done a kissogram, and I never actually did, because I didn't really promote it very widely. But I remember at one point I was criticised because that doesn't look good as a therapist, because the implication was that I was kind of in the sex industry, kind of. But my thought really is a highwayman kissogram. It's much more about the character. It's much more about a highwaymanogram, really, that I just appear and say stand and deliver, and you know, and then you give them a quick kiss and then you go. I'm not setting myself up as somebody that women would want to kiss. You know, the great thing about being a highwayman is you're wearing a mask. They can't actually see what I look like until they're kissed, and then I'm gone. So you know, for me it was very much not a, you know, not a sexual or sexualized service. It was like a fun service, really. That was the way I looked at it. But it did come up once, and I was you know, I was sort of criticized for that, and it was good that really that was pointed out. So you can see a bit of the distance now. It's starting to clear, but I need to clear off. So hopefully that is the end of this topic now. Hopefully there will be no part 4 because I've forgotten something. Let's give you a final glimpse of that blue sky. Is that enough to make a sailor a pair of trousers? I'll leave you to answer that. Thank you for watching. I'll catch you in the next one. Rangimarie.